Why don't we just say who we are one by one? This is Bill Taylor.
Good evening. This is Bill McGinnis.
Mike Cruz.
Hello, Mike. Looks like we have
Joanne Becerra.
Excellent.
Ray Cussing.
Good evening. I just saw Mark Conaby. I'm sorry, who is that?
I'm here.
Okay.
And I'm here as well.
Okay, it looks like John has joined us.
I think Mike is on mute.
Yeah.
Me? Can you hear me?
Mike's unmuted.
Okay, well, good evening. I'll call the meeting to order. Well, as once again, it's a learning experience.
Cover in there.
Sorry, what's that?
I don't know who's talking.
You just said you can't have her in here.
Okay, well, let's see. Who's not muted? Okay, I actually don't see Joanne. Joanne, are you,
Look,
I'm here.
have to go in there and stay, or I'm gonna have to move.
yeah. Okay, well,
I'm here.
I don't see you up top. Is there a picture of you, or are you just on the phone?
No, I don't have a camera on my computer, so I'm the the phone icon right now.
Ah, got it. Okay, well, let's dive into tonight's agenda, which I now have to move closer to the screen to read. But it looks like the first item up is operational update from Cheryl.
Okay, so we've had, as you know, that we keep getting guidance that keeps changing from day to day. But the most recent guidance today that you probably all are aware of is the order that Governor Baker outlined today that basically asks all businesses and organizations that don't provide essential services to work remotely and stay home. And those those businesses that have been identified as essential at this point would be the healthcare facilities, transportation buses, dental for emergency services only, restaurant and bars for just the takeout or delivery, supermarkets, banks, pharmacies, shelters, gas stations, auto repair, residential treatment programs, hotels, critical government workers, sober homes, and then laundromats and construction workers. So that's just a basic rundown of the list. So in addition to that, the Mass Department of Public Health is going to be issuing a stay-home order, which I have yet to see, but I'll get that to you as soon as I see that. We, as the health department, we have been notifying all of our businesses that we currently do business with, which is quite an extensive list when you go with sealer weights and measures for all the cash register scanners. So we have a pretty extensive list of the businesses. And what we did was reach out to all of them today to ensure that they received this guidance. And for those that we didn't have email addresses for, we've been calling. I feel like we've done a pretty good job at that. You know, we pretty much spent the entire day doing that. So the other issues that we have is I've received a few phone calls today from businesses that feel that they're essential and they're not necessarily on the list. So I do want to talk to you guys about that at some point during the meeting. I don't know when you want to do that, Bill. But I've
Sorry, had to unmute.
Can you hear me?
Yes, I can. And just you asked the question about when should we discuss folks that feel they should be.
Yeah.
Why don't we wait till you reach the end of the description of
Okay,
the impact of the order.
okay.
Cheryl, this is the other bill. In the executive order, at the end of those 8 pages of essential workers was a URL to request if you want to become an essential worker. So
Correct. So that's what I've got, that's what I've advised,
that's a state decision. I don't think we should be deciding who's essential and non-essential.
yeah, so I've advised them to, click on that link and submit that, request to the state. What I'm wondering though is in the interim, I'm not entirely sure if the state will get back to them before noontime tomorrow or not. So I was looking for guidance on what you would like us to do. Order those businesses closed until they receive that notification from the state. So that's what I'll talk about, when I'm done with everything else. So also, we've been, we as the entire town of Acton with nursing and Laura Ducharme, who's our community service coordinator, we've been reaching out and trying to, ensure that our residents in need are also being addressed. So we've actually had a conversation with the Minuteman Inn now, I guess it's called, to possibly use their rooms if needed. So things are turning. Like I said, we're just trying to keep up with all the new orders and make sure that they're properly enforced by our department.
Okay, thank you. So maybe this would be a good time if you feel there's some folks that could you just.
There are 10 people on chat, and they look like they want to say something relevant. Someone should be monitoring chat.
So I'm on chat right now, Bill, and everybody's asking to be unmuted and if they have a question. So if you want to let me know when to invite them in, that's fine.
Sure, let's do that after we have the board discuss this issue. So could you describe what businesses are, because I guess you're going to have to make a decision at noon tomorrow if there isn't guidance from the state.
So one of the businesses is they're classifying themselves as a home improvement store, and they are currently listed on the list. I think I personally feel it's a bit of a stretch, this type of business, but this documentation is read by 10 different people and read 10 different ways. So what it says in response to this business is, hold on, let me get it for you. Commercial retail stores that supply essential sectors, including convenience stores, pet supply stores, auto supplies and repair, hardware and home improvement, and home appliance retailers. They're classifying themselves as a home improvement, even though they're a purveyor of homes but they do sell parts of homes. So that's where I thought it got a little tricky. So I just wanted some guidance on that. And then the other one is a bike store who claims that there's been provisions granted by the other states, that bike stores can be open because bikes can be used for delivery of products or so forth. So those are the two that I have right now.
Okay. Well, Dr. Bill, you brought the subject up. Do you have an opinion?
No, I think they should go through the state.
Yeah, that seems reasonable. The question is, what do we do in the interim?
I would suggest that probably trying to be conservative and be best, because the whole goal is to minimize contacts. So it would be prudent for them to try to do it remotely and read the order as constrictive rather than being open-ended and trying to fit into some category to remain open.
Okay. Mike?
Yeah, I agree with Mark on this.
Okay. Well, I agree with Mark also. Joanne?
Same here.
Okay. Rika?
Yes, I also completely agree with Mark because at this point they should not be running their business because it doesn't seem to me that essential. And if they contact with it, like at this time, self-isolation is the best. So I think Mark is right on that.
Okay. Looks like Tom is not on tonight. Is that correct? Carol, do you know if Tom's on?
I'm just gonna check the other list.
He's in the attendee list.
All right, I'll get him over.
Okay.
And no, I think it should be pointed out that it's not that the business should close, that they should operate remotely if possible.
Yeah.
Yeah, although if they're selling, physical items, I guess you could do like the restaurants do a curbside delivery. But
Okay, I'm here.
all right, so Tom Jacoby, did you just join us?
Yes, I'm here. Yes, I agree. I was listening.
Great. Well, Cheryl, I think you've got the board's consensus opinion, which also appears to be unanimous.
So not necessarily close, but social isolation.
Yes.
And work from online.
Yes.
Okay.
Unless they get guidance, they should also then address their case to the state. The state makes a different decision, we'll abide by whatever the state decides.
Okay.
Okay, so you mentioned that some folks wanted to make comments. This is probably a good time.
So let me go back to them. All right, so there is a Ben Dover that would like permission to talk. So give me 1 second and I'll unmute him. Sorry, I'm new at this.
This is new for all of us, I'm afraid.
Yeah. I don't see him now.
Not sure that was a real name.
Let me go back to chat. Let's see. Yeah, I think.
Cheryl, I think he may have disconnected.
Okay. Oh, was removed due to spam. So sorry. All right. So looks like we're all set for questions right now then.
Very good. Okay. Sorry. Would you mind putting the agenda back up, Cheryl?
Yeah, I think David Martin's doing that for us, but he'll do that in a sec.
1 second. Nope. Hold on.
I didn't even see the minutes. Well, you had previously indicated there were a couple of things that we needed to discuss related to, I think the case collaborative was one, and apologize, I forget the other, but this would be probably a good time to bring those up.
Okay, so I received a call from Case Collaborative in Acton there at Post Office Square, and they are seeking, they're requesting board action to vote to close them. They are going under the guidance of the Department of Education and DESC, I think it is, and they are currently closed till March 30th, but they would like to follow the school schedule. So I'm sorry.
So the case is closed until March 30th?
Currently, they're closed until March 30th, yes.
Okay.
I did reach out to a couple of other towns, and I had not heard back from them. I did reach back out to the gentleman I spoke with, and he told me that there's really only one case collaborative, but there's other collaborators in the state. So what I've asked for is to see if those other collaboratives are closed, to help you guys make the decision.
Cheryl?
Yeah.
Yeah, I think the case is the Concord Area Special Education Collaborative, which Acton is a member with other communities. My experience has been that they follow the schools in which the kids are enrolled. So, well, the resident school. So if Acton is closed, then typically the school in Acton would be closed. That was their policy years ago. And a lot of cases, the classrooms are in the schools as part of their mandate. So I would think that those are certainly closed. Now, where they're up in Post Office Square as a separate program space, it might be a little bit different. I know there has been a lot of conversations with Desi, who runs the programs for the education. The residential programs are mandated and listed in the emergency order as they must remain open.
Right.
Now, as case program, I don't know. We should really check with the case office. It sounds like they contacted you to request that they be open. Is that correct?
No, they request for the board to close them.
So they're currently open, you're saying?
They're currently closed till March 30th, but they do not want to reopen. They need Board of Health vote to, I guess, order them closed.
Okay. So it probably would be best to check with the state, particularly DESE office, because they have special rules regarding those schools. The case, I think that's kind of surprising. The Victor School is a private school for special education, has different rules because it's a therapeutic school. And I guess those really ought to be clarified. I would suggest we do that since they're probably both closed during this interim period. But obviously it is a substantial risk, but it's also a special population where the kids have substantial likelihood of regression with interruption of services. And with the limited social services programs right now, therapeutic schools, I think in general, have been open, though a lot of them have closed, and they have received permission from the state to do that.
Right,
Yeah,
so, go ahead.
The other thing I was going to suggest is, particularly in the case of case, which is a collaborative, the decision should also be collaborative. So that's why I'd asked Cheryl to reach out to the other towns and see what their approach is. And, we should do it as if we're going to order a closure, then so should the other towns or vice versa.
We should also check to see what the Acton Boxborough Regional District is doing with students that are placed at that program from our district. We should coordinate that as well.
Yeah. So it sounds like we have a little time, but that reminds me, I was going to ask Cheryl if you could post a meeting Thursday for the board. If we don't need it, we'll cancel it. But perhaps just get it on the agenda, or excuse me, get it posted so that we have a legal meeting. Okay. So it sounds like we have an opportunity to gather some data before we need to make a decision.
Okay.
Maybe even a snow day.
Yeah. Except it's supposed to be warm tomorrow. So, okay. See, we have somebody that's looking to ask a question.
Yeah, so I also wanted to discuss with you whether or not, we voted last Thursday to close the fields, but we did not vote to close tennis and golf. So given, new guidance that's come down today, I'm just wondering what your feelings are about that. I do have Kevin Curley, who has raised his hand to talk to you, but we want to discuss first. What the new guidance says is 10 people or less, and, can remain outdoors It's under one of the advisories, and I had it in front of me, but I've been messing around with papers. But basically, 10 people or less, and it can technically open to the, oh, here it is, gatherings. The order doesn't apply to public gatherings of more than 10 people in an unenclosed outdoor space, such as a park, athletic field, or parking lot. While permissible, this type of gathering is not advised, provided the individuals must follow social distancing protocols by remaining at least 6 feet apart. So when we talked about this on Thursday, we talked about that those two sports would be okay, and then the more we got thinking about the sweat and people touching the balls, we started to wonder if we should address this. So that's why.
Cheryl, quick question. Are these businesses requesting it or for town facilities?
There's the person who would like to speak this evening has a business in Acton.
So the essential services business would cover this, correct?
Essential service businesses. Yeah, yes, it's under that. It's under that order, and it's also under the guidance for assemblages.
So my point is that the order from Charlie Baker was requiring all businesses and organizations do not provide essential services to close their physical workplaces and facilities to the customers and public as of tomorrow. So wouldn't that apply to all these other, that would apply to these, wouldn't that already address it?
Well,
Hi, this is Tom, if you can hear me. I'm a member of Butterbrook Golf Course, which is partially in Acton. They are closing down as of today. So I think Quail Ridge, which is in Acton, should also shut down as being non-essential. There's just too many things that happen on the golf course that are not safe at this point.
Okay. All right. Well, why don't we let the person that was looking to speak have an opportunity to address the board?
All right, let me get them for you. Kevin, you should be unmuted.
Yeah, can you guys hear me?
We can. Thank you.
How are you? Thank you, guys. So my name is Kevin Curley. I own a program called New England Tennis Center, and we have a few indoor locations, and one of those are in Lancaster, and another location is in Westford. Both of those indoor locations are 9 tennis courts, and we shut those down, very early on. What we were hoping to do is that, based on activities such as hiking, cycling, and what you've seen in some of the other states under these, shelter in place, is that there is the recommendation of, people need an activity and people need exercise. They need to be able to get out. So what we did is we have the 2 outdoor courts at Quail Ridge, and I have a few outdoor courts in Westford. And we stopped all. And what that means is if you think about, tennis, if you guys don't, anyone here plays tennis at all, but if you think about tennis in the sense of play, is you're competing. You're sharing a ball and you're playing back and forth. What we did is we shut that down. We locked the doors to the indoor clubs and for the outdoor clubs also. But we said if people, want to do a hit, a supervised hit, which means they want to get some exercise, they want to get out of the house, they can contact a coach, and it's reservation only. So say, for example, someone says, I want to go for a hike at 11 today. If they say to me, can you hit with us outdoors, where they're permitting, outdoors only, at 10 o'clock today, we would be at that location. And it's not match play. It's just simply hitting. You've got one person, it's a 6,000 square foot area. You've got one person on the other side, and you're just rallying with that person. You're not sharing the tennis balls. So that's why we were running it as coach supervised. And that has worked incredibly well. And once I saw this, the first shelter in place from Dr. Baker this morning, we were pretty disappointed about it. And then we saw the revised edition. We're like, well, that makes sense. People can walk into a liquor store, grocery store. What we're saying is you're going to step out onto a tennis court for a 60-minute duration of time. You want to get some physical exercise. You hit, you don't touch the balls. You have your own equipment. We have our own equipment. And then you walk off the court and that's it. There's no actual play. And I think that's why, even in the town of Acton, and other towns, you not just walk on the courts and play, because that's definitely an issue, in sharing a, quote unquote tennis ball. But that's not an issue if it, instruction only. And that's what we were hoping to continue, because there's a lot of people that, simply just want to go out and they need to get out of the house. They want to get exercised for their mental health, and they simply just want to hit. And that's the nature of the game. It's not just in the traditional sense of actually competing.
Okay, thank you. So obviously I'll ask for interpretation from members of the board, but for what you described, sounds like you are practicing the social distancing, and it seems like that might be able to fit within the guidelines. Comments from other members of the board?
Bill?
Yeah.
My first question is this a business? Because if it is, it's covered by the order, and it's not one of the enumerated businesses, and it's not essential, it's to close. It's pretty straightforward. Unfortunately, it really is. As much as we'd like to do a lot of things, the whole idea is to minimize the risk, and that's why they're prohibiting certain gatherings and closing spaces. If it's an activity, unless it's an essential service, an exercise, can take other forms, it's enumerated to close, period. They want an exemption, as Bill said, I think, like they say, you can request it to be designated as an essential function. It's not covered by guidance. So I guess the point is, it's pretty clear from the order that unfortunately have to close. And if they want to have an exemption, they have to request it from the state, which we would then follow.
My understanding, this was an outdoor activity, so that's why I was, perhaps I'm wrong. Mr. Carley could comment on that. Is this indoors or outdoors?
It is outdoor only. And what you're going to find with sports like golf and sports like tennis, in many of these states that are shut down, they are still allowing these sports, these outdoor activities, to run, because there are ways that in a supervised fashion, there's actually no contact whatsoever. So sports like soccer and basketball and field hockey and lacrosse with equipment, you really cannot play those at all. But a lot of these states are saying, we understand that, you're going to be in your house for 2 weeks, and potentially a lot longer. So to try to some capacity coexist, with what's happening is that we understand that you need to leave your house. And if you want to, play golf in a manner where you're going to go out, you're going to walk the course by yourself, you're going to play, or you're going to play tennis with a coach, there's no contact at all. And you're actually nowhere near 6 feet of the other person. And that's why a lot of these states, these shelter places are allowing this. And I think that's a big part of the revision that came out today. The original, shelter in place was very straightforward. It labeled businesses among many, many industries. But then the revised order said, well, if it's 10 people or less and it's outdoors only, that logically does make sense. And I think that's, where we're coming from as a business is, yes, it is a business, but it is outdoors. It's only outdoors. It's shine only. And you are more than, 12 times what the distance is.
Okay. Well, it sounds like another one of those difficult situations where we're trying to feel our way in a very unfamiliar territory. Mm-hmm. I thank you, Mark. I appreciate your comments. I mean, they're on point. Are there other members have comments?
Yes, I think you can't start carving out a lot of exceptions. I know with a golf course, you're playing with other people. Even if you're playing with yourself, your ball goes against a flag stick, which somebody is going to pick up and move, then somebody else comes along. So while on the surface it would seem to be safe, when you consider the actual game itself, you realize that there are a lot of things that can or will happen that are against all of our guidelines. So I would, if there's a vote, I would vote against this as an exception.
Okay, thank you. Other members? Mike, Bill, Rika, Joanne?
Is this an Acton business?
Presumably, I believe. I'm
Yeah.
not sure.
I thought you said Westford and.
Yeah, my indoor locations, we absolutely shut down. It's outdoor locations only that, we felt comfortable, obviously staying open.
And where are those located?
So the 2 courts are at Quail Ridge Country Club in Acton.
So
The golf course that we're thinking should probably close.
So this is Mike. I have one question. Did I hear that right? That there was original guidance and then revised guidance that was put out
That's correct.
later? Okay, but what is the issue that the Acton order is more restrictive, or is
That's
it?
what it feels like. Yeah, after the first order, it was obvious. Then the revised order was saying, if you read it, if you read section 3, it's pretty clear. If it's an outdoor activity and it's less than 10 people and you follow social distancing, it should not be a problem. And it seems that, we're kind of going against the grain a little bit, because there are many, many golf courses, in these other states that are open, but it's in tennis, it's to the discretion of the person running it, saying, hey, we understand in a logical manner, if you have a ball and I have a ball and we both touch the ball, that's an issue. But if we're 70, it's the same thing as when you have someone who runs a liquor store, that doesn't want you to touch their credit card.
Why don't we just check the times? What was sent out to us was signed by the governor at 9:25.
So I think the order he's referring to, the revised guidance, is prohibiting assemblages of more than 10 people. I sent that to you, and I read that before we started. It says the order does not apply to public gatherings of more than 10 people in an unenclosed outdoor space such as a park, athletic field, or parking lot. While permissible, this type of gathering is not advised, provided that individuals must follow social distancing protocols by remaining at least 6 feet apart. What the original guidance, the long guidance today, where the governor outlined essential services, that prohibits all businesses unless they're listed on that guidance. This is actually talking about public gatherings of 10 or more people, the revised guidance, unless Kevin knows of a revised guidance on businesses. I'm not aware of that.
I think you've got 2 different things. You've got the governor's order with an exclusion as he talks about limitations on gathering. But that talks about, for public things, it doesn't talk about a business. This limitation does not apply to the operations activity of any business. So it's quite clear that of essential services. So I think you can read the 2 together, and it's very clear that the governor's order limitations does not apply to businesses. For the exclusion, it's just businesses are only essential services only. So unfortunately, I don't think there's anything we can do. It's pretty clear. The order is that they close. It's not our decision.
So this is Joanne. So from reading the other, the assemblages order, if my husband and I want to go to an outdoor tennis court, there's 2 of us who are outdoors with our own balls and equipment, that could be allowed because we are fewer than 10 people and we are practicing social distance. But we are not a business. Yeah. That's the difference, I think. Right?
Yeah, I believe that's Mark's point. Although it gets even a little more complicated because if you're sharing the same household, you're probably not social distancing anyway. So it would be distancing from other members of the public. So we're trying to make up the rules as we go along. It sounds like, Mr. Curley, what I'd suggest is you should bring your concerns to the state. I mean, it sounds like you actually have a reasonable approach, but as Mark points out, that's not a decision that we're being permitted to make. So
Okay.
we probably can't make it.
Okay. I appreciate all your time. It's obviously a difficult time.
Well, like I say, I wish you success, because it sounds like a reasonable thing to do, but it's a case that hasn't, it isn't covered by the existing rules.
Right, I understand. Thanks so much.
Thank you. Cheryl, you had a list of other things, other nettlesome questions to give us. I remember one had to do with porta potties, but there was another one that I'm forgetting.
Do you want me to project that list? I have the whole list.
Yeah, if you could, that'd be great. What about golf? Because we have some golf people on the on listening to us, and we also have a couple hands raised too.
Do you see the list, Phil?
I do. Thank you. Just trying to figure out what a good process is. For the raised hands, do you have a sense of what it is you'd like to comment on? Is it related to this issue or just general question?
One person actually asked about the update of confirmed cases, and I think we have Heather on the line that she can give that update when we get to that. So I think that one can wait. And the other one, I don't know what the question is.
Okay. So perhaps it would be helpful if the people who have questions, please submit your question to Cheryl, and then we'll try to work it in at the appropriate time. Next one on the list for here is town field closures, and you prepared a letter to the town manager about how we'd approach that, Cheryl. I think you're just looking for for the board to endorse your letter.
Yeah, that would be great. We did send, that letter has gone out. It went out in an update yesterday. We closed all the town fields that are listed in the letter. We did also mention that playgrounds and basketball courts were closed. And then we go on to talk about social distancing, and that letter, like I said, has already gone out. We did reach out to the schools separately. I should note that this morning, all fields were marked closed. And then there were some notes on those closures about social distancing, if they're just like going for a walk or kicking a soccer ball with the son or something like that. But and we did ask the schools separately to also post their fields closed. And they're working on that, and I haven't heard a response for that.
Okay, thank you. Very good. Dave, would you mind putting the other list back up? Thank you. Oh yes, the reusable bags for grocery shopping, temporary rescission of that ordinance. So as Cheryl let me know, I know we mentioned this in one of our very first emergency meeting. There's a study that says they can actually, if they're not washed carefully, they can actually spread disease in the store. Since then, I understand, Cheryl, you said that Roach Brothers is going to prohibit reusable bags in the store. Wild's coming next.
Correct. And I think others. We received word that Roach Brothers this morning stopped allowing reusable bags at 7 a.m. So they've already made that policy. But what the question is, what's happening now is some of the suppliers are some of the stores are having a hard time getting the paper bags delivered. So they're wondering if they can use their plastic bags temporarily, until this virus threat passes. And you know, I think if the board's inclined to do something like that, we should definitely encourage them to maintain their stock of paper bags, but there are quite a few of them are worried that they're not going to be able to.
Okay, and so this would be a recommendation of the selectmen to, you know, whatever the correct legal term is, but put that particular ordinance on hold and allow the stores to use plastic bags again. So, in that case, I guess I'll just say that seems like a reasonable thing to do, but I would appreciate members to comment. I happen to see Mark's face up on the top of my screen. What do you think, Mr. Crowdy?
It seems very prudent from a public health standpoint. Has its other consequences, but you know, allowing their use during the public health emergency would seem to be prudent steps, so would certainly be advisable. I don't know what the action would be. I'm thinking it would be from the Board of Selectmen, but the board can just recommend it, or they can order it. But since it's already existing provision in town, I would say call the Board of Selectmen as the appropriate board, the select board, to do that this time.
Right, so I guess this would be a recommendation of the selectmen that they temporarily suspend that ordinance and allow the use of plastic bags. Just moving across the top of my screen next up.
I think you ought to put it during the public health emergency.
Sure, yes. Next up is Dr. Jacoby.
Yes, I agree. Temporary usage would be a good idea.
Okay, Dr. Taylor.
Yes, I agree.
Mr. Cruz.
So what are we, just to clarify what the request is it saying we'll allow the plastic bags? And are we also keeping the paper bags?
Yes. Yes to both.
Okay, so it's just reusable bags are not allowed.
Yes, that's correct.
Okay.
And that's actually not our decision. That's not the board's action. That's the stores are saying that due to health reasons, they, on their own initiative, are prohibiting them. But they're asking for the board's support to be able to allow them to use plastic bags because they're running out of stock on the paper bags.
Oh, I didn't know that.
Yeah.
I guess that makes sense with general lack of paper products. Yeah, that's fine.
Okay. Looks like Rika is next.
Yes, I agree with that.
Joanne?
I agree as well. And did I hear, I was asking about, so the time duration, and somebody mentioned, during the public health emergency. So I'm assuming that if the Board of Selectmen vote to do this, there will be a, time certain. It's not in perpetuity. It's a temporary
Right. That would be
allowance.
that would be my assumption as well. I mean, if the town wants to rescind it permanently, I would assume that would be a town meeting action.
Correct. Yeah, no, I agree. It makes sense.
Okay. All right. So, Mr. Martin, do you have enough to carry this forward to the selectmen, or would you like a board vote and a letter?
No, I don't think we need a vote. I think we can carry it forward, and I assume since this is an urgent matter, we can take it up even not on the agenda. John's on the call, so John can add to the agenda if he thinks that it's an emergency measure. So, but I think I understand that the sentiment of the board here seems to be unanimous.
Okay, very good. Thank you.
Comment. To the degree we have local folks trying to find solutions to reduce the risk and help the community, we should encourage it.
Very good. Okay, so I think we've already covered the tennis and golf assemblage. Perhaps not. Perhaps we haven't covered golf because Dr. Jacoby was asking about Quail Ridge. And I believe, Dr. Jacoby, your opinion was that golf courses would not be covered by the guidance from Governor Baker. In other words, that should close.
I believe that they should close, yes. There are a lot of issues when you're out on a golf course. People generally don't play by themselves. I know some golf courses are raising the cups off of the green so the balls don't go into the hole, because if you can't remove the flag stick, you've got to squeeze your hand into the hole to get a ball out. And depending on which, if you use a gloved hand or a bare hand, eventually it's going to just wind up on your equipment and contaminate it. So it's very difficult to make it completely safe. So I know that a lot of golf courses are closing. I think they're closing on their own. I'm not sure what the legal issue is, but I think we should certainly. I think that we ought to prohibit golf courses being open, just because there's too much there that can happen, is uncontrollable.
Okay, thank you. I am not a golfer, so I'll actually say I don't think I've ever been on a golf course other than cutting across one at some point, but never with a club in my hands. So I'll ask for opinions of other members. Mr. Conaby, I happen to know that you have stood on a golf course with a club in your hand.
Yeah, just a 2-iron. What did Mark Twain say? It's a lovely walk through the
Lovely walk spoiled.
spoiled by a little white ball.
Yeah.
I think it's covered by the governor's order, where it's a non-essential business which is closed. As Dr. Jacoby aptly points out, it is a social sport, but it also has other issues as far as touching other things, such as, you've got a whole bunch of different opportunities, and the whole concept of this is to minimize risk and to socially isolate in appropriate manners. And unfortunately, this isn't the time for that activity. So, it's, I guess, the same point. It's covered by the governor's order, so the business would not be allowed at this time.
Very good. To try to just expedite the process a little bit, let me just ask, are there any members that disagree with Mark's point?
No.
Okay. Hearing none, then let's say I believe that's Shirley, you've got the board's guidance on that. Are you comfortable with where we are?
Would it be possible for them to apply for an exemption as well, as you directed the tennis?
Yes, of course.
Okay.
Yeah.
Okay, and also, there's a couple statements on the question and answer I just wanted to read to you about the golf. Golf courses have new rules from PGA, no need to touch the flag this year. Raking bunker with your foot allowed in bunkers. Most courses in Stowe opened without bathroom access, and now that it's snowing, courses will close for a while again. So I just wanted to throw those out there in case you didn't see them.
Okay, thank you. Like you say, it sounds like we've got a little break. They can apply to the state. If this, we'll certainly follow the state guidance, but it appears that the rules are at the moment that they would not be able to operate.
Okay.
Moving down the list, the next one has to do with household hazardous waste day, and recommending a postponement, or suggesting if we should postpone it. I'll just throw out my opinion. I think postponing makes sense, even though it might be possible to hold it and still maintain social distancing. I don't believe that there's any particular urgency, whether it's held on the day it's planned or it's held a few weeks later. Ultimately shouldn't make that much of a difference. So I don't, on a cost versus benefit, I just don't see the cost is small, but the benefit is zero. So I would recommend we postpone it, but I'd be very interested in other members' opinions. Another member care to comment?
Joanne.
Oh, Joanne.
Hi. I agree. If, there's no harm in postponing it till, we feel like it's a safe time to do so. So I have no issue with that.
Okay, thank you. Any other members who wish to comment? Well, hearing none, Cheryl, I'm going to suggest that I believe it is the sense of the board that should probably be postponed until a reasonable time. The next thing on the list is the closure of private schools. I think we've sort of discussed that one already. We hopefully will gather more data. There'll be further guidance perhaps from the state in terms of the special nature of the schools. And we can hopefully come up with a consensus or a collaborative approach.
Cheryl, sorry, Bill. Are there schools that are special education schools that are indicated in a town for this? The Victor, which is private, and Case, which is a public collaborative?
So I tried calling the Victor School today with no answer. So I'm assuming they're closed, but until there's no message on the machine indicating that. So I can keep trying, but I think they may be closed. I tried them a few times today. And then, like I said, the Case. So I'll reach out, as you guys advised, to see what I can gather for information for everything that you asked for.
Please. The second, I guess, most important question to ask is whether it's has a residential component, because those are on the specific list of services that cannot be.
It doesn't. It does not. It does not. I'm not sure about the Victor School, but Case not.
Case obviously not, but JRI does have residential programs. That's why I wanted to double check that. I thought that Victor was just a day school, but and of course transportation of the kids to and from is an issue as well.
Okay.
Thank you. Next up is porta potties, and I think Cheryl, maybe you can explain specifically which porta potties you were referring to.
So as you know, people have been getting out and enjoying the nice weather, and we discussed this today at a staff meeting, and we have porta potties at public parks that are not being cleaned, and it's very difficult for us. It would be almost impossible for us to be there 24/7 to properly disinfect a porta potty after each use. So we recommended staff-wise that we can't remove them because the company's not responding to us, but we're suggesting that we lock them up temporarily. So it got me thinking I should seek board guidance on the banning of porta potties, whether you want to do that just for public use, like if a construction site has a porta potty for their workers, that's another. Usually, that's the two reasons we have porta potties for an event, which obviously have all been canceled. But there are some just permanently placed at our parks and our walking trails for use by the public, as well as any private person that may need to get one for a construction site. So I'm just wondering what your guidance would be on that.
I would suggest that certainly the public ones, locking them makes sense. The private ones, that's another tough question. Mark?
Question: if they're a construction site, aren't those non-essential services? Most of the construction sites, certainly in Boston and areas, have already been shut down. So
no, the guidance on the governors today. Let me try to find it for you so I can read it to you.
Yeah, I think it does reference construction.
Yeah, it definitely does.
But it wasn't clear if it was public works construction or private construction included.
There was definitely, I gotta find it now.
next to the last page on the governors, yeah, it's a question of whether or not you want to have those sites, and raises a whole bunch of issues as far as if you're going to have those construction sites. Obviously, sanitary facilities, group of 5, now you have issues of how large a site they are, and then of course you're going to have the issue of having the inspectors go out to those inspection sites for the town. So I don't know, has the building department given you any guidance of whether they can continue to support those operations of going and checking residences and other projects?
So right now, they are going out to sites that are outdoors. I did get some guidance today from the commissioner. Let me read that to you. So I guess Cambridge has done an order. I don't have my hands on that, but he's saying that everything that they're currently doing in Acton would be allowed to proceed. So what they're doing is just going into any unoccupied building. So they're not, running the risk of having a gathering of 10 or more. They're doing outside inspections. So they're still permitting and working on construction in Acton. So that the guideline, he found it there. Construction workers who support the construction, operation, inspection, and maintenance of construction sites and construction projects, including housing construction, is deemed essential by the governor.
Okay. I mean, certainly emergency repairs and things like that would be a good essential service, whether you need a water heater replaced or electrical service for fire safety, those type of things. But, the construction, I guess if it's exterior only, if it can be supported by the department, but the offices are closed, I don't know.
We're still working. We're pretty much working remotely, partially remotely, or fully remotely.
The inspections have to be on site, so that's not remote. That's the issue.
Right, but we don't have to be fully remote. So we're still doing septic inspections. We're not going into the office to get the paperwork. We have it all online now, so we can look at the plan online from their phones while they're doing the inspection. So, we're still doing those. Anything outside, we are not currently going inside establishments for inspections unless it's really deemed necessary. And if we do have to, we're going to be looking to be outfitted with personal protection equipment. But currently we've been able to deal with everything fairly remotely with the need to go, do septic inspections, which we've designated to 2 days per week.
And you practice social distancing, I presume, when you're at the sites.
We've submitted to all the installers. We've submitted protocols, which include, so previously they used to leave a bucket of water, and we'd go down and we'd take the cover off the distribution box, dump the water in, make sure everything ran properly, and off we go. So one of the protocols that we've implemented is the staff, the worker has to be there. They have to be the one that lifts the cover. They have to be the one that dumps the water. And so we can maintain that 6 foot separation and still conduct the inspection.
Okay. So back to the original question is, what do we do with porta potties? So it sounds like, the ones at Narrow Park, for example, since there's not going to be organized sports, group sports, if someone is just going to jog and then return home, locking the porta potties is probably a reasonable thing to do. As far as a construction site, it sounds like they're an allowed activity, so they probably need to have a place to use a porta potty. I guess there's concerns about construction sites, certainly for emergency repairs and other things, but it doesn't seem consistent with some of the other activities that are being deemed not essential. It doesn't, but that being said, it also is an exposure for a lot of the staff, which may be needed for more critical things going forward. So I think we've got to be very careful scheduling these type of routine things, considering the circumstances and the environment. Okay, thank Well, what I'm suggesting is that for starters, we should certainly close the ones that are in public spaces. Is that agreeable to you, Mark?
Yes, I mean, Narrow Park was closed, so closing the porta potties as a health risk certainly seems reasonable, especially if they can't be serviced safely.
Other members, I'm just looking down, picking in order. Joanne Bossetti, you moved to the top of the list.
Lucky me. Yeah, I agree that they should be temporarily closed while the park is closed and while our health staff is working on other important issues.
Great. Dr. Jacoby?
Yes, I agree that they should be closed. I'm not sure what you do with like home improvement projects. I've seen a couple around town where they're replacing shingles and windows and have a porta potty. I don't know what you would do with that.
Well, what I'm sort of suggesting, I mean, that's a very, hopefully that's not a very, there's not a lot of that particular situation. If they really need to have a place to use a restroom, it seems reasonable to provide it. Hopefully they're practicing the same good procedures for distancing and disinfection and so forth that they do on the job site itself, because construction workers often, are physically close to each other, and they hopefully are modifying their practices to in line with the guidance from the state. So hopefully they'll do the same with the porta potty, would be my thoughts.
Bill, it was suggested that we order all porta potties not in support of essential services be closed. How do you feel about that?
That sounds reasonable. Other members?
I just have a concern, unless authorized by the health director. So let's say some septic system fails or being installed for an emergency failure, they want to put one on site. That seemed like the essential services aspect, but
Okay.
yes, maybe just close with the exception to allow the health director to make that determination at the park.
That was reasonable. Mr. Cruz? Sorry.
Yes, yeah. So I think, if it's in support of essential services, people need bathroom facilities. But I think maybe ask if there are only a few, if they could get locked up when the construction site is not active.
Okay. Dr. Singh?
Yes, I agree with the locking the porta potties at the parks and other public facilities rather than the ones which are for the construction sites.
Nice. Dr. Jacoby, have I passed over you or?
No, I spoke her.
Okay, then Dr. Taylor.
I agree with Mark.
Always a good policy. Okay, all right, very, very good. Is that helpful, Cheryl?
Yeah, that's great. So one thing I forgot that I should have mentioned early on is we have Heather York with us to give you an update, and I probably should have thrown that on our list of discussion tonight. So
Yeah, that's great. I saw Heather on the attendees. Always very grateful that she's willing to spend the time to come talk to us. So please, Heather, share your updates if you would.
Hi, thanks for having me. Appreciate it. So my updates right now are based on what is going on in Acton at the moment, and I can give you a few numbers between Acton and the city. As of today, there are no positive cases in the town of Acton, which is great. I don't feel that it will always be that way with the coming days, but I'm glad that it's still where we are. As you all know, the numbers for Massachusetts, I'm sure you are aware, went up to 777 today. positive cases in the state. We talked at a staff meeting earlier today, and it's interesting that the numbers of infected are typically between 20 and 59, the majority within the state. As of before the new numbers came out, there were only 83 cases above 70, which I think is really positive. It tells me that seniors are staying in place with their homes and trying not to interact, and hopefully their families are doing the same, you know, bringing them things instead of visiting and having social interaction with them, but dropping things off so they're not going outdoors. So I think that's really a positive showing on social distancing, that the most at-risk members of the community, the elderly, the numbers are really remaining low. Hopefully anyone who has an underlying disease are also, you know, following those guidelines of social distancing and have folks to help them. On our end, for our nursing service and for disease surveillance, as I said the other night, we are calling all of our clients that we see within the homes for the visiting nursing service prior to going in. One, to make sure that there is no one within the household that has been sick or has symptoms of COVID-19, but also to assure them that the staff coming in also does not have any symptoms of COVID-19. I had a staff meeting on Friday to reiterate the social distancing, visits with clients, making the phone calls, doing your hands-on services, but then backing off to the 6 feet. There's a lot of assessment and discussion about medications and things like that that you can do with not standing so close to someone. So limiting that interaction. On the Department of Public Health and how the process works, and I'll just give a quick little overview because I'm sure you all know this. As positive cases or suspect cases are coming through the Department of Public Health, the Department of Public Health follows up and finds and starts doing the mapping to find the contacts. We then, as a town and other towns within the state of Massachusetts, will get that information on if you have a positive case, if you have a suspect case, if it's a contact case. All of that is funneled through the Department of Public Health, as labs and doctors' offices and hospitals are required to report that to them, so that then we can, as a local public health department, follow the people within our community for that disease surveillance and monitor their symptoms, give instructions on how to keep themselves isolated within the home from other family members, the guidelines of how long they're under quarantine, and what their guidelines are once they come off or have reached the end of their quarantining.
Well, thank you. Heather, I actually had a quick question. You say you're following up with contact tracing. I've heard anecdotally that some towns are making use of the school nurses since the school is closed, and since they're licensed nurses to do some of the contact tracing. Is that something that would make sense in our case?
So it would. If that time comes, that's definitely someone I will be reaching out to. I have spoken with Diana McNichols at the high school. She is one of the lead nurses. That if that time comes, or if the time comes, down the road of, a drive-through vaccination or drive-through testing, I definitely will utilize whoever I can from the school systems. I actually have a public health nurse, Linda Cullen, who is working more hours than typical as I requested this through John, the town manager, to ask if we could do that as, you know, things are ramping up, obviously. But I also have a per diem nurse that works with us who has a history in public health also, a big background. She just left the Tewksbury Public Health Department. So she's available also if we need it. And then we go forward with the schools as needed. But it's a great recommendation.
Okay, well, thank you.
I'm wondering, do we have any contacts that are currently self-isolated in Acton?
We do have a handful of contacts that are self-quarantined in Acton, yes. None of them are positive cases.
And how far along are they in the isolation period of 2 weeks, do you know, roughly?
Sure, the majority of them are almost at the end of their quarantine timeline. I believe 2 of them come off tomorrow. One actually came off today, I believe, also, and one new that will be out into next week.
Okay, excellent. Can you keep us posted on that?
I can absolutely do that.
Yeah, because the contacts are important. And the other thing that we haven't talked about really is I imagine there are people that have cough and fever in the community who aren't tested but could have coronavirus.
Sure. So any of the doctor's offices in the area, and I had quite an extensive conversation with Dr. Knights at Acton Medical, and also one of the pediatric doctors who I'm not going to remember the name of off the top of my head right now. I did have an extensive conversation with them about people within the community and other communities surrounding Acton who have been to the doctors within the last few weeks, who the doctors sent home as a precaution. They asked them to self-isolate, whether it was an adult or a child within the house, or self-quarantine. But that information is supposed to be given to the state if there's a definite question of COVID-19, and they have not been, because the doctors have sort of been on the fence based on the guidelines that keep changing as every day goes by. And these folks hadn't been tested because it was before testing really had expanded. Right. So those people that doctors have been saying, you know, maybe you should go home and self-quarantine just to be safe, we don't get that information because it's not considered a true quarantine based on EPH guidelines.
Yeah, I think we need to start considering them as clinical cases because the testing is not going to catch up to the number of cases.
Well, my guidance as a Board of Health is to get the information that the state gives us.
Okay.
Otherwise, I don't have that information coming to me from the doctor's office, and I don't know if they can honestly share that information because of HIPAA violations and HIPAA guidelines.
The public health overrules HIPAA.
Correct, but they're not being diagnosed and they're not being reported to the state, so it wouldn't be public health at that point. That's my understanding.
Well, actually, the board did get a report of a potential case, and 2 people are being self-quarantined. It's unlikely. They're perhaps a contact exposure, but it's less likely. But of everything we talked about tonight, these issues of community cases are much more important than trying to close down venues. I think the governor has done that effectively, and we need to make sure that people are getting the follow-up in terms of isolation. And I think what you've done on the ones that you've heard about, you've tracked them almost to when they're no longer considered infectious, if they ever had it. So that's good work.
Thank you. Thank you. So I see we have some questions coming in, but let me ask if there are other members of the board or Mr. Martin have.
Yeah, I had two things. I think Bill is correct. The community transmission and trying to track them and having a way for members of the community to report it so we can track it would be, and we can assist them if they need it in the future, would be very important. And the second thing is the MEMA update last week was saying to the towns to keep track of the costs of these additional services because there will be reimbursement from funds. So I think that's really important to Heather realize that we keep track of those costs because this small agency is very important with the finances.
Thank you. No, we definitely are keeping track of the extra additional costs that we're using other staff to assist during this time.
Other members, questions or comments?
Yeah, Bill, I had, I think 3 questions for Heather. And at this, first of all, thank you for your team's work on this. This is probably a very difficult time for you. But my first question is kind of related to that. And it's, do you have all the PPE that you need when you're doing the visits?
So as of today, we do not have any N95 masks or any gowns. We would only need those if we were going into a house that had a positive or a suspect case. And that's not the case with the public health guidelines. We typically do a telehealth call on a daily basis to anyone that's quarantined, so we don't need the PPE equipment as of yet.
Okay. Would you be able to get it if you started needing it, I guess?
So the town has put in some orders for PPE equipment, specifically for EMS and police. But I'm sure if that need arises, that we would be able to get stuff from there as long as they don't need it more than I do, I guess.
Yeah, I think it's my experience is to prepare for the need before you need it, especially with the number of cases. It's really exploded over this past week.
Oh, sure. I absolutely agree. I think the priority right now is the emergency personnel in the hospitals. Public health, obviously, as we expand and get more cases and have to do face-to-face follow-up or testing out in the field, that's definitely something we are looking into getting.
Yeah, thanks. So the other question probably this doesn't exist now, but do you know if any hospitals or the state is planning for drive-through testing?
I haven't heard of any, to be honest. I do know they're putting different locations up throughout the state, the different laboratories. CVS is doing them at their locations and sending them off to
labs.
But I haven't heard of any hospitals as of yet, but more could come down the line.
I'd heard UMass Medical was, but it's only for people who have a prior doctor's order for the testing. And I think you should clarify not all CVSs are doing the testing. We don't want to do that, just specific sites at this time.
No, that you're correct. I'm sorry. I should have said that. I apologize. But yes, you're right.
I just want to clarify for anybody who's listening.
Yeah, no.
Misinformation.
No, that's great. It's definitely a case-by-case basis. And my understanding of that is it's only emergency personnel primarily and hospital personnel. And then I think it's to, beyond that, it gets a little squishy on who falls into that next bracket that they'll test.
Okay, thank you.
Yeah, I just had one other statement on the testing. The Broad Institute in Cambridge, either they're approved now or will be next week for testing. So I think we'll be able to see the testing capacity increase dramatically from here on.
That would be very helpful.
Yeah, I agree. That would be very helpful. Thank you.
Other members, questions for Heather? In that case, Cheryl, do you see any questions from members of the public that are directed at Heather?
Hello?
Hi, Cheryl.
No, this is, hello?
Hello.
Hello?
Oh,
We can hear
yeah,
you.
this is Angie, so, and this is a resident, not the board member.
No.
Okay.
Can I, yeah, thank you for taking my, my question. Yeah, thank you for clarifying. So, because, the question I have is more from the resident, community question, which is, for example, that last week is the college spring break and lots of college kids come back home and they're traveling and the family may self-quarantine the student, and because they may have been under the case of that they are in contact with, it's like a contact cases. So I went to the town website. The current process, from my understanding, I may be incorrect, but on the current town website, it says contact your physician, and because I assume the physician, if there is a case, then they will let the Department of Health know that, then therefore the local public health will be notified. But right now, my understanding, most of the physicians, for example, my own health insurance, the way they handle it is they will not even see you. They will ask you just to stay home. Therefore, this kind of falling into the case that Heather just mentioned, which is there may be cases, and because of the short of testing kit, and these cases were never being tested, and they will not be seen by a doctor because the doctor doesn't take them at this point. For example, my insurance will not take me if even I tell them. They will just talk to me over the phone. So my question is, right now the current process, my understanding that the town asking people to see the physician, but the physician will not take them. Therefore, the case will not be recorded. So is there any way we will be able to, for example, like the town is able to say, if you suspect, let the Department of Health knows that, so at least somebody knows in the loop knows this is, we have a traveler, we have people maybe just came back from Italy, we have something in the community. So I would like to clarify more like a reporting process from the community member perspective.
Yeah, I would think you could contact the Board of Health. The concept of the doctor seeing them, I think, is important if someone's ill and they have cough and fever. And although they may not want to admit the patient, they can always be prepared to make a diagnosis clinically. And the idea of self-quarantine is if you stay, whether you're sick or not, if you stay 14 days at home without going out, you are no longer contagious. Because it takes about, even if you're exposed to a case, it takes about 5 days before you might become ill. And then it takes you another 7 or 8 days before you've totally recovered. Now, if someone gets ill with cough, fever, and shortness of breath, then they probably need to see the doctor. And that can be arranged. They can prepare to see someone. I know that there was a case seen in the emergency room in Emerson, and they were able to diagnose the patient. It did not require hospitalization, and isolated for those 14 days.
So, okay, I thought this is Department of Health. No, this is. I thought I'm joined because I thought this is the Acton Town department, the health department.
It is. It's the Board of Health, but we're associated with the Health Department.
Okay, so what I'm asking, so you don't see that there's a value to change the process for the resident to alert the Board of Health?
Yeah, I think it's valuable.
Okay, so because currently on the town website, it is saying it doesn't have that process. It is saying go to see the physician.
Okay.
Could I make a comment? It's Heather.
Oh, okay, thank you.
Sure. So the guidance right now is that if you are symptomatic, you should call a physician because the boards of health cannot diagnose you or send you for testing. So that's the first guideline.
Okay.
The second guideline about travelers coming from high-risk international countries, as they come into the country, that information is being funneled to the Department of Public Health, which then funnels it to the local Board of Health to follow up on those residents within town who have been in a high-risk country. And then they're on self-quarantine. For any other travelers, there isn't any guidance related to quarantining them. So if somebody went on spring break and went to Florida or the Caribbean, which are not high risk, and one is inside the United States, as of now, there is no guidance having them be reported to the Department of Public Health through the DPH process.
Yeah, thank you. So how about like Washington and California or New York? Is there any guidance on that?
As of today, I have not seen any guidance. As a public health department, I mean, my suggestion, and I'm not a doctor.
Okay.
So my suggestion for anyone traveling and coming back on an airplane would be to self-isolate themselves from the rest of the family within the home. But that is just me as a public health nurse.
Mm-hmm.
If there's symptoms, if there's a question of a high-risk area, California, New York, New Jersey, these folks need to reach out to their doctors. They are the ones that are sending residents for testing and making that determination. Unfortunately, it's not in our realm as a nurse to make that recommendation or order those tests.
Okay. Yeah, thank you. So this is just, I'm recommending that maybe valuable to have the resident have a channel of input if any possible travel that may have occurred in the past 14 days. And because this is not what's stated on the Town of Acton website. And I just have, the second part is, there is a local effort, community support group that's trying to help the resident that self-quarantine within the 14 days because there are people, they may need grocery, they may need to pick up the prescription. So there is a group of volunteering and doing that. So I'll be happy to support that and to connect that, to make that connection. And the other community support is there is a big effort on collecting masks and also making masks right now. And also have connection and had actually, I myself, I just, I waited for a month. I bought some masks for donation. I'd be happy to donate some to the Public Health in Acton and of the face mask because I actually literally just picked it up today. I waited for like 40 days for that. So there is a tremendous community support effort going on, and just want to let you guys know there are we need to make some connection, and so we can provide the resources from the community. Thank you.
Great, thank you. Cheryl, are there any other questions for the board or for Heather? Cheryl, are you with us? I can see you. Oh, you're muted. Unmuted, Cheryl.
Yeah, she's enabling the next person.
Oh, okay.
Hello?
Hi, Tara?
It's Tara Fredericks from West Acton.
Hi, I recognize the voice. Please go ahead.
Yes, I'm quite upset that I didn't get to speak during the tennis discussion. And I'd like to understand why you didn't take public comment.
Well, I guess I'd answer that by saying, in general, we try to hold public comment to the end of the meeting. I'd asked about framing the question just so that we'd know if it was related to the topic being discussed or it was a general question. I'm sorry if you didn't get an opportunity to ask the question when you wanted to, but this would be your opportunity if you still would like to.
Well, I'd like you to reconsider that because I feel like, at least today, I was walking about outside and I was watching a construction crew and they were laughing and working together 2 feet from each other, and I, from afar, urged them, talked to them about social distancing, etc. They basically laughed and said that they were essential workers and didn't have to obey any rules. And I thought, and then here's this nice tennis club that is following very, very strict rules. And I feel like either the construction workers have to obey the rules too, or we should be letting these places that are adhering even more strictly to operate. That's my first comment. My second comment is that I feel like there should be public comment for every vote if one wants to encourage democracy, nourish democracy. But my other comment is regarding the. It seems like there's a inclination on the board to go with what the state says, or let's, because there's no specific exception for this guy, then we didn't want to take a chance. I feel like you guys are experts, you guys are doctors, and that the nature of a state of emergency moves very quickly, and they often don't, it's a moving, it's a moving bus, and that the home rule, Massachusetts is a home rule state, so Governor Baker, as he said tonight on NPR, he doesn't have the authority to restrict movements of individuals, for example. And in a home rule state, as you, I'm sure, know, relative to septic and water and controlling pollution, that the town can be stricter than the state. And so, relative to exceptions, I believe that we do have the authority to allow, if we think that, if you guys think in your expertise that something is such a low risk, that it's worth staying open. I believe we have that authority. And so I feel like we should be exercising that authority because I'm almost done. These businesses employ minimum wage workers that have basically no protection. Yes, there's an eviction moratorium, but as soon as the pandemic is over, they're going to have to come up with all the money. And so I see an epidemic of homelessness coming if we don't allow these low-risk businesses to operate. The number of people that touch a milk jug in a day, moving it about, is way more than two guys that are touching a tennis ball. So I urge you to reconsider and get some guidance from town council on what you can do relative, instead of just saying, well, because we don't know, make them go through the state. I feel like we should take the lead on making decisions locally and using our authority to keep as many of these businesses open as possible that are in fact low risk, because of the workers that are involved. This is going to be a catastrophe if we don't. Thank you.
Thank you, Tara. Rather than open a debate, I just say, we do appreciate your comments. Believe me, we do try to balance all of the different concerns. It's not an easy task. We hope we're doing the best we can, but the citizens of Acton Cheryl, are there other comments?
No, I don't see any, Bill.
Okay. At this point, I'd just like to poll the members and Mr. Martin as to whether or not there are other topics that we should be discussing. Happen to see Dr. Taylor at the top of my queue at the moment.
I've been at the bottom all along, Bill.
Well, you're moving up in the world.
But no, I don't see any more topics.
Okay. Tom, Jacoby?
No, I don't think so. I think we're done.
Mark?
A few things. I mean, obviously, we start to need to do more preparedness planning, some contingency planning for shelters and work facilities and lack of resources like PE. But getting back to construction, when I read through the thing, it said construction, not new construction, but it said construction for maintaining the safety, sanitation, essential service, operation of residence, construction sites, and projects needed facility. So I'm not sure about new construction, but I just want to clarify that for the department going forward. Getting back, I guess I'd like to see an opportunity at the next meeting to start looking at some of the other planning things that we had in the emergency plan, and as things are progressing, unfortunately.
Okay. Thank you. So I figured out that every time somebody talks, it causes my list to reorganize itself, which makes it somewhat difficult for me to keep track. But I think, Tom, did I already just ask for your input, or?
Yes, you did. And I did think of one other thing. In town, I believe we have a medical reserve corps.
We do.
Have we been given any thought to what they may help with?
Yeah, well, actually, Heather might be the best person to answer that, but we've certainly looked at reactivating it, and it would certainly be a resource if we have to do something like drive-in clinics or testing or vaccinations. It would allow us to greatly multiply the service providers. Heather, do you have anything to add to that, or?
This is Cheryl. We actually reached out to the coordinator, and they're on alert. They're just kind of ready and waiting, and we've actually gotten a few new people to volunteer. So, I hate to say there's a good thing with the public health emergency, but I do hope that list will get bigger if the need arises. But they're ready and they're active, and once we give them the word, we can get them involved.
Great, thank you. Did that answer your question, Tom?
Yes, it does. Yes.
Thank you. Mike?
Thanks, Bill. Tara's, one of her questions reminded me of Thursday, because as you recall, I brought up the stay-at-home order, and I think, Cheryl, did you have an action item to check with legal counsel? And I know it's kind of moot with the governor coming out with this order, but
I can answer that one, Mike, because I actually saw it. Cheryl shared with us, and you just probably haven't caught up yet. The town council, I believe her name is Nina Cook, did provide an answer to that, and her answer was there isn't any specific, law. However, it appears that we do have that authority. And I don't know, Cheryl, I think 2 days ago shared with us a letter from the Attorney General that was outlining model regulations if we wanted to do a quarantine order. And so the town council referenced that as saying, well, if the Attorney General is citing model regulations for boards of health, that would imply the Attorney General feels that the boards do have that authority. So, I guess, like, what I'd say is I think actually the answer is yes, and yes, they did follow through on that action.
Okay, I'll catch up with the materials.
Yeah. And you also are, I think, correct that it's a little bit, Ms. Cook, the town attorney, starts out by saying, well, this is probably overcome by events due to the governor's order, but then she proceeds to outline what the board's authority is. Moving forward, Ms. Becerra. Comments, questions? Further action, Joanne?
Wait, hang on. Can you hear me now?
We can
There
hear
we
you
go.
now.
Okay. A quick public service announcement about people flushing things other than toilet paper for our wastewater treatment facilities as well as septic. I don't know if we have had any issues locally, but if as information and websites get revised, perhaps just a note about what not to put down the toilet.
Okay. Always a good reminder. Mr. Martin, do you have anything from the selectmen's view you wish to add or question?
No, I just one comment. I think maybe two comments. The governor has already issued a stay-at-home advisory. So that's not quite in order, but it's an advisory. And also, my second comment is going forward. I mean, I think it's kind of odd to have this, don't do anything except the all businesses have to close except businesses listed on the list. I think it's more important myself, frankly, to tell people what they shouldn't do or what they should do. I'm wondering if for future meetings, if this board wants to consider things like orders to town businesses as to how often their checkout areas need to be wiped down, as an example, or other that businesses that remain open and essential, how far how the physical distancing rules work for those businesses, or they must still practice those things. So I'm just throwing those out as ideas for future consideration.
Okay, very good, thank you. Well, I noticed that, let's see, we had on the agenda the minutes from March 16, but I don't actually recall seeing those. If they were distributed, I missed them, so I'm probably not in a position to offer any comments. I'd actually like to suggest we defer these to a future meeting unless someone on the board really feels passionate about moving the minutes forward. I'm going to suggest that we can defer these minutes to a future meeting. Cheryl, I apologize, but I just didn't see them. So,
Okay, no problem.
Bill, do you need a motion?
I don't think so. I think we'd need a motion to accept them, but I don't think we need a motion to just defer them. We do need a motion, though, if we wish to bring the meeting to a conclusion.
I'll make a motion to do that.
Very good. I believe it's to adjourn. Was there a second for the motion to adjourn?
Second.
Oh, I think Joanne had a second.
She beat you by a second.
She did.
Okay. Motion is made and seconded to adjourn. All those in favor of adjourning, please say aye.
Aye. Aye.
Aye.
Great. I think we've got at least three, so I'm going to say meeting adjourned. Thank you very much, everyone. I know this is difficult. The format is difficult. The subject is difficult. And we're all trying to do something that probably no one has ever done before, because this is a very unique situation. So thank you again for your service to the town, your dedication, and your commitment to the public health.